Welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie. After learning a ton about kidney stones and helping people prevent stones at the University of Chicago, I was fed up with all the terrible advice people were finding online. So I decided to do something about it. The Kidney Dietitian was born. This podcast is for people who want to learn what actually works to prevent kidney stones and still enjoy life, eating, and their favorite foods. Let's dive in. Hello and welcome to the 130th episode of the Eat Away Kidney Stones podcast. As always, I'm your host, registered dietitian and kidney stone expert, Melanie. And today I wanted to dedicate an entire episode to the new Dietary Guidelines. If you are unaware, the new Dietary Guidelines that are written by the government every 5 years, so we were due for an update because the last one was from 2020 to 2025. So we are in the next rendition of the Dietary Guidelines from 2025 through 2030 in theory. And so I know that as many things in the world right now, things are very, very political. But as a registered dietitian and someone who has dedicated their life to helping improve the health, specifically kidney health, that's what I do. I felt like it was definitely warranted to dedicate an episode of the Eat Away Kidney Stones podcast to the new Dietary Guidelines because we all know about them. Again, I think in my feed, my feed is obviously a little bit skewed to be very nutrition heavy, given what I do. But I do think that the Dietary Guidelines and certainly the health and nutrition of America has been in the spotlight lately, and the release of these guidelines kind of has been the pinnacle or the thing that we've been waiting for to see how the current administration is going to improve the health of Americans. So let's go ahead and dive in and see what my thoughts, again, as a kidney dietitian, are on the new Dietary Guidelines. I certainly am going to get into the nitty-gritty of what the specific recommendations are, but I wanted to kind of start this episode with the general rhetoric and conversation around the excitement of these Dietary Guidelines. If you go and look at any of the governments, specifically the Department of Health and Human Services or the government itself, websites itself, the rhetoric around these guidelines is very much like we are returning to common sense, quote, we are promoting real food again, quote, and the government is no longer recommending ultra processed foods, quote, and we're just getting back to getting people to eating real food, as if this is some sort of very novel, very exciting thing that hasn't been happening for literally decades. Because it has never been the case, at least in my history of being a dietitian of, 15 years now, and certainly before my time as well, the government has never been recommending that Americans eat all of these ultra-processed foods. This has literally never been the case. Yet, if you go onto any website or many conversations around these guidelines, that is what the excitement is. Like, oh my gosh, thank goodness, we're finally recommending that people eat fruits and vegetables and protein. Like, no, we've been telling people to do that for a really, really long time. If you look at any press conference, even the actual diet, like the website for the new Dietary Guidelines is literally realfood.gov. Like, it's so like this real food is their sort of tagline. And it kind of drives me nuts, as if we previously weren't recommending that people eat real food. Like, we were recommending people eat fake food, whatever that is. I'm not really sure what the definition of real food is. But even so, like, I feel like their thought process is that, real food is like, quote, natural food. Again, whatever that means, there's no real definition of what natural is. But like the previous rendition of the guidelines, which is my plate, which we'll talk about in a second, literally did recommend that people eat fruits, vegetables, grains, protein, and dairy. Like, literally, if you're unaware, the most recent rendition of the Dietary Guidelines was my plate. It was not my pyramid. And my plate literally explicitly shows on a plate what foods and food groups should be on your plate. And so this whole nonsense around this, like, is the first time that we're recommending real food again. And again, literally in the intro page of the new guidelines, it literally says that the government's no longer recommending ultra processed foods. Literally, that was never the case. And I just want to point out that all of this rhetoric is very much in line with the exact same subject and the exact same thought process that wellness influencers have been using for a very long time to discredit true experts. As someone that spends quite a bit of time in the online wellness and nutrition space, because that's literally my job, I get attacked daily because I'm promoting the food guide pyramid. Because if you go, in many of the uncredentialed wellness influencer space, people are talking about how the food guide pyramid is poisoning people and how in the world can dietitians and the government be recommending the food guide pyramid. Well, in fact, the pyramid that they are always referring to and the pyramid that is explicitly shown in that realfood.gov website, this is the food guide pyramid that went away in literally 2005. That is the year that I graduated from high school. Showing my age here, but so it's not been around for a really long time, and it's really quite alarming to me that the people who are supposed to be in charge of the health and nutrition of America are literally calling out this food guide pyramid as if they didn't review the last two renditions of the guidelines and the last two sort of depictions of how those guidelines were shown to the public. It's mind-blowing, but it's very much in line with what wellness influencers have been saying for a really long time, again, to discredit actual true experts. Despite the fact of a very simple Google search would show that food guide pyramid, I believe, was put into existence in 1992 and again went out of commission in 2005. Literally 21 years ago, that food guide pyramid that is called out as this terrible toxic food pyramid that was recommending all this ultra processed food, which it wasn't. Even that food guide pyramid wasn't recommending ultra processed food. But regardless, that has been away for 21 years. My pyramid was, the food guide pyramid was replaced with something called My Pyramid for a short amount of time from 2005 to 2011. I can remember these dates pretty easily because 2011 is actually the year I graduated with my master's in clinical nutrition. So just kind of funny. But anyway, so My Pyramid, again, was a pyramid and it had all these rainbow stripes on it that were supposed to recommend or sort of depict different food groups and whatever. So that was around for a short amount of time. But since 2011, the food guide pyramid in any form has been gone. And instead, the dietary guidelines are depicted by something called My Plate, which is literally a plate. It has silverware next to it. And it literally says fruits, vegetables, protein, grains with milk on the side, you're supposed to have a glass of milk with it. So it's very much in line, sort of very big picture with what the current dietary guidelines are recommending, that people eat, quote, real food, again, whatever that means. So it's just kind of ridiculous. And I always like to start these conversations, friends have asked, what do you think of the new guidelines? I just always like to kind of point that out first, because I think that's kind of the biggest harm and nonsense that is being spewed everywhere is oh, it's the first time, finally America's going to be healthy because we're recommending them eat real food. Are you kidding me? This has literally been going on for decades. So, very silly, very silly. But moving on to the sort of nitty gritty things that I like and don't like about the new dietary guidelines, because I think there are definitely some good things in there, but definitely some things that I prefer not be there or prefer be sort of framed slightly differently. So I think the good thing is that there is continued focus on fruits, vegetables, protein, whole grains, and dairy. Again, highlighting the word continued because this has always been the case. For my entire career as a registered dietitian, this has always been the focus, that we encourage that people eat fruits, vegetables, minimally processed, in fact, fruits, vegetables, protein, whole grains, and dairy. So I like that we are continuing to promote that people eat minimally processed food. I'm all on board for that. I also like that there is the continued specific limit on sodium to no more than 2,300 milligrams per day. This is, again, exactly what the previous guidelines recommended. And so I'm happy to see that sodium limit was carried forward and that continues to be in the guidelines. I like that the guidelines continue to talk about added sugar. The previous guidelines recommended that added sugar be limited to no more than 10% of calories. The current guidelines don't say, as far as I can see, any sort of specific amount. They do have some guidelines around specific amounts that you might look for on a specific amount of food, but it's a little bit more vague. There's not really a clear cut, this is how much added sugar you should be eating. It just says to basically minimize, which I think is fine, but I do wish that there was a more specific amount to help people know how much is okay. Because like, sure, if you look at how much is okay on a specific product, like the guidelines do give a couple very, very specific examples, that's fine. But what if like all you were eating were those added sugar products? You're going to get up to more than what we want, right? So it really makes a whole lot more sense to look at the big picture and look at maybe how much you might want to be aiming for per day to help people actually implement these guidelines, right? Hopefully that makes sense. So anyway, but I was getting too into the weeds there, but I am happy that we talked about added sugar and how we don't want to, of course, be eating a ton of added sugar. I also like, again, that there is the continued recommendation of mostly fresh, minimally processed foods and limiting processed foods or limiting ultra-processed foods. Obviously, as a registered dietitian, I am all about that. That has always been the case. That always likely will be the case. So this is not new, but I am, of course, happy that we did continue this recommendation of eating mostly fresh, minimally processed foods. Now moving into some of the things that I don't love about the new dietary guidelines. One of the things that most stuck out to me, like right off the bat when I first looked at this document and I opened it up on my computer, it's just filled with endless contradictions. Most notably around saturated fat and a few other things, but definitely the most obvious one is the contradiction around saturated fat. So the guidelines say that we should be limiting, the current guidelines say that we should be limiting saturated fat to no more than 10% of calories, which is exactly what the previous dietary guidelines said. If you do the math, that ends up being about 17 grams of saturated fat for someone who's consuming about 2,000 calories. I wanted to kind of help us put it in context there because I feel like 10% of calories is very abstract. But assuming that you need around 2,000 calories, that equates to about 17 grams of saturated fat per day. The problem is that this recommendation, which I'm all on board with, I think that eating a ton of saturated fat is not great. I know that this is very controversial. However, the data is overwhelmingly, like the best data that we have says that when you eat a ton of saturated fat, it's not great for your heart, which is ironically literally the number one cause of death for Americans. So I feel like this is a very relevant topic for dietary guidelines that are supposed to be helping the health of Americans. So they say that we should be limiting saturated fat. However, if you look at every other thing on there regarding what types of foods we should be eating, they are recommending very heavily foods that are incredibly high in saturated fat. If you look at that food guide pyramid, the first thing that you see, because we of course read from left to right, so at the very top, on the top left, there is a giant steak, then a giant chunk of cheese. There's also a giant chicken, whole chicken. There's also a giant carton of whole milk. And shortly below that, there is a giant stick of butter. All of those things are the foods that are highest in saturated fat. In fact, a study found that cheese, beef, and milk alone provide a combined 33% of the total saturated fat consumed in the U.S. So just cheese, beef, and milk alone, 33% of the saturated fat. So it literally, it would be impossible to consistently consume the foods that they are most recommending and keep below that 10% of calories from saturated fat. For context, they're recommending three servings of whole milk per day. If you've been on this podcast or been around me for a long time, I am all about milk, right? I am all about dairy. That is a wonderful thing to help reduce the risk of calcium oxalate stones. However, we previously wanted to recommend low-fat or fat-free dairy because whole milk contains a lot of fat. And yes, we could get into the weeds and say that, there is definitely some evidence to show that saturated fat from dairy perhaps isn't as bad, but at the end of the day, it is still saturated fat, and it is quite a bit of fat and calories also, which is funny because they talk a ton about how weight is all these concerns, yet we're recommending people eat these super fatty foods, including whole milk. But anyway, so it's impossible to do what they're saying, which is to generally keep saturated fat to less than 10% of calories while consuming a significant amount of your food from the foods that they are most recommending, which is of course notable because another way that wellness influencers love to discredit true health professionals is that they say that we're all bought off by big food and big pharma and we don't know what we're talking about. And, I cannot count the number of times that people have told me that I'm a paid shill and that my entire education is a ploy because it's all been, basically dictated by big food. So anyway, I just like to point out that, certainly not saying that the dietary guidelines have always been political. I'm not saying that politics has not influenced what the dietary guidelines have said in the past. That would be ridiculous. It certainly has. And certainly we know that, bias plays a role in research and plays a role in all sorts of things. However, the difference is that in actual dietary guidelines and in actual, research papers and in recommendations, you have to disclose those conflicts of interest. And also as someone who is a responsible consumer of research and someone who has been educated as a healthcare professional into how to interpret those research studies, you look to see what those conflicts of interest are, and you take that into consideration when you are looking at the greater body of evidence, right? Plus, we understand that any paper that is published in an actual research journal has to be peer reviewed. They are peer reviewed research journals, and those reviewers do not have that conflict of interest. That's one level, like a safety net, right, to help reduce that conflict. Because at the end of the day, certainly we know that the food industry does sponsor nutrition research, largely because we need someone to pay for that research, right? Like nutrition research is actually notoriously expensive, which I don't need to get into right now, but it's very expensive. We need someone to pay for it. And so, I think it's fine that industry pays for that research as long as all of the safeguards are in place to make sure that we are interpreting that research. It is being reviewed by people who don't have that conflict of interest, right? So we know, it's just kind of part of the game, unfortunately, right? If we could have all nutrition research be funded by totally unbiased sources, of course that would probably be better, but that is not the reality that we live in, right? So anyway, point being that certainly the dietary guidelines have always been political, and there's always conflict of interest no matter what you're talking about. But the difference is that when you're getting information from actual doctors, dietitians, nurses, PT, OT, speech, whatever it is, we have to disclose those conflict of interest. I give 15 to 20 presentations for other healthcare professionals a year. And every single presentation I give, I am required to disclose any conflicts of interest that I have. Just to help us all be on the same page and expose those potential conflicts of interest. The difference is that the wellness industry has none of those requirements, right? The same people that are yelling at me because I am this paid shill and like big food is paying me off are getting paid way more money to hawk their supplements, their unproven supplements, because they're not regulated. I just had to point out the massive double standard that exists in the wellness industry from the people that are being so critical of dietitians, because the wellness industry is actually worth I should have looked up these numbers. It's like $1.3 trillion, whereas the entire pharma industry is only worth like $300 million. Don't quote me on those numbers. It's something like that. But the point being, the wellness industry is way bigger, and no one talks about how, the people have a massive monetary incentive to discredit doctors and dietitians so that you are left desperate and you need to buy their crazy expensive supplements and whatever it is, right? So there's this massive double standard that I just needed to point out, especially in light of this very animal heavy food guide pyramid and recommendations, right? But when you go and look at the people that were the scientific advisors to the current guidelines, about half of them, a little bit more than half, have direct ties to either beef, pork, or dairy. So oh my goodness, right? That is so one-sided. The previous renditions of the guidelines certainly were political. However, at least there was influence from a wide variety of food groups in different sectors, right? But this is unbelievably just being influenced by beef, pork, and dairy. So just needed to point that out because I think that definitely clearly has played into what has ended up in these recommendations. So anyway, the bad things. First, contradiction is saturated fat. It is going to be impossible to do what they're doing, which is to keep those 10% of calories from saturated fat. That's going to be possible to do that and actually eat the foods that they're recommending. For context, one serving of steak, 3 or 4 ounce piece of steak is going to have probably 8 grams of saturated fat. Remember, we're aiming for no more than about 17 grams per day for those 2,000 calories. Each serving of whole milk is going to have 6. If you add some butter on there, which they are recommending that you add healthy fats, and they are including butter and beef tallow as a healthy fat, then that is going to be another 7 grams. So you see how it's going to be impossible to do that by just consuming essentially those 3 servings of whole milk, which is going to be about 15 grams of saturated fat per day. You add in 2 servings of meat, which you're supposed to be eating a ton of, it's not going to add up. It's literally not going to work. The next contradiction that I don't love is sodium. And this is getting a little nitpicky, but I think it's important because sodium, I'm pretty into sodium here on on the Eat Away Kidney Stones podcast, sodium plays a pretty big role in kidney health. And so they do say, as I mentioned earlier, to limit sodium to 2,300 milligrams, yet in the meat section, they say to, if desired or something, add seasonings such as salt, which is literally the first thing that they mention, or spices and herbs. And although, I'm all about, you can totally add a little bit of salt here and there, but I just find it very odd that these are such boiled down guidelines to only 10 pages. So there's not really a ton of words in there. And the first thing they say is to add salt to your food to help season it. So I thought that was a little bit weird. Another thing that I find very strange is this huge focus on fat, which comes straight out of the wellness sort of low carb keto diet playbook, right? If you're not eating carbs, you need to get calories from somewhere, and it ends up being protein and fat. And so literally the third thing, I believe, in the bullet points and the sections, it says like eat the amount of food you're supposed to, eat a ton of protein, and then it says add healthy fats to every meal, of course, specifying butter and beef tallow as healthy fats, yet these things have the saturated fat that they're saying is bad, but whatever. But I find it very funny because fat is by far the food that has the highest amount of calories per gram. Carbs and protein have 4 calories per gram of food, and fat has 11 calories per gram of food. And so I'm not advocating for a low-fat diet. However, it is a fact that fat has the most calories per gram. And so, of course, in the intro to the guidelines, they're, talking about how, rates of obesity and overweight are so high, and this is such a concern. Yet they're then saying, okay, go ahead and eat all of this fat, which has a lot of calories. Again, not saying we want a low-fat diet, but I think that promoting more fat, when we know that people are already eating a lot more fat than they need, just doesn't really line up, right? Like, I don't really understand how encouraging people to eat more fat, which is providing a lot of calories, is going to help with the weight of the country. So, that's another sort of huge contradiction I wanted to point out. And the last contradiction this is a contradiction / major criticism of the guidelines, is sort of the contradictions and massive downplaying of the importance of fiber in a healthy diet. They do mention fiber just twice in that 10-page public-facing document. For context, protein is mentioned 17 times. So fiber is mentioned once in terms of gut health, and they also mention fiber again in the whole grains, which is the very last section. Basically, they're saying whole grains are great because they have higher amounts of fiber, and that's why we should choose whole grains over refined grains. However, there's no specific amount of fiber that we should be consuming per day, which I think is very notable because that is something that we are getting the least of, right? Whereas most Americans are getting plenty of protein, hardly anyone is getting enough fiber. And yet we know that eating adequate fiber can help reduce the risk of most of the most common causes of death in the U.S. Again, heart disease, as well as cancer and stroke, as well as kidney disease. That's not a major cause of death, however, worth mentioning here on the Eat Away Kidney Stones podcast. And so I think that, again, there's sort of this inconsistency, right? We're saying like, yes, fiber is good for you. We want it for good gut health, and we want to recommend whole grains. However, when you look at the foods that are highest in fiber, the foods that are highest in fiber are whole food plant protein. So things like beans, nuts, seeds, lentils, right? These foods are on the food pyramid, yet they're very, very tiny and very clearly not as important as meat and chicken and dairy, right? So we've got the plant proteins on there, but they're downplayed, and we clearly want to be eating this super high saturated fat and fiber free steak over these super healthy, I would argue, plant-based proteins. The other highest source of fiber in our diet is whole grains. And yes, I did say they said that we do want to be eating whole grains in the like literature of the guidelines. However, if you look at the food guide pyramid, which is notable because most people are not actually going to read the guidelines, right? Like most people see that one image of that food guide pyramid with a whole bunch of clip art pictures on it, and they say, all right, this is what I'm supposed to eat, which is basically protein and vegetables, right? So anyway, whole grains are on there, but they are at the very, very bottom. They are very clearly at the bottom and the smallest section of that food pyramid. And so it is going to be very difficult for people to get in enough fiber with minimizing the importance of whole grains as well as those plant-based sources of protein, because those are generally the highest sources of fiber in our diet. Yes, fruits and vegetables are up there, and that's obviously wonderful. I am a registered dietitian. Of course, I want you to eat more fruits and vegetables. They are great. They do have fiber in them. However, they do not have nearly as much fiber as whole grains and those plant-based proteins. And so it's going to be super duper duper difficult to get in at least the recommended amount of fiber that we wanted to get in previously. Again, there's no amount of fiber that they are encouraging us to consume per day. But if we move the numbers previously used forward, it's going to be really, really hard to get those without really focusing on those plant-based proteins as well as whole grains. And I think it's also worth mentioning that if you're unaware, so there's a giant like 2-year project scientific report. So a whole bunch of really smart nutrition researchers like sit together and they put together this giant document that's sort of outlining all of the research that they want to go into the dietary guidelines as a nutrition expert. The people that sit on this panel come from a variety of backgrounds. There's doctors, there's dietitians, there's just like nutrition scientists, right, who don't necessarily work with patients. So kind of people from a whole different diverse group of backgrounds. And then they put together this huge report and hand it to the government and say like, cool, like this is what we think is best. And then that is where that political influence starts to come into play, right, historically as well as in the current guidelines. And I actually probably like 6 months ago sat through a webinar from one of the people who was on that scientific advisory panel to the dietary guidelines to kind of give us an update. It was me and a whole bunch of other dietitians through the Academy of Nutrition Dietetics to kind of understand what they were recommending that the dietary guidelines say, right? And it was super interesting and just helped me understand the process and all these things. And honestly, in terms of what the scientific report said that should be in the guidelines that was coming from these nutrition scientists was not that different than what the previous version, than what the My Plate version said, right? What the guidelines from 2020 to 2025 said. It was things like eat fruits and vegetables, eat whole grains, make sure you don't eat a ton of added sugar, added salt, right? Like things that are sort of like, of course we know that, but really the biggest shift, so really the biggest change or emphasis that they recommended was ironically a bigger focus on plant proteins, probably because there has been tons of data that has come out the last 5 years helping us understand the role of the gut microbiome and the importance of fiber playing in that, the benefits of eating a more plant forward diet for the disease prevention of basically every chronic disease under the sun, including kidney disease and kidney stones, right? So that really was the biggest shift in their recommendations from this scientific report, was that we should probably be focusing more on plant protein instead of the previous guidelines that kind of recommended both. Like the language wasn't very strongly worded towards animal or plant protein. It was sort of like get protein from a wide variety of sources. But instead the scientists were saying like, all right, I think we should like strengthen that language definitely to be more focusing on whole food plant proteins, right? And what do the dietary guidelines do? It is steak and chicken and fish, right? Like, oh, so that's not great. And so basically that sort of downplaying of the importance of fiber / whole grains / plant proteins, those biggest food sources of fiber, really irk me. And I really wish that there would have been a bigger focus on fiber in the guidelines. The next thing that really is just upsetting to me is kind of this egregious promotion of protein in general, specifically animal protein and animal fat. I've already kind of talked about the specific concerns around saturated fat and with that like giant steak in the top left corner. But in general, like beef, poultry are always listed first as the best protein sources in those guidelines. Literally after there's the pyramid in the 10-page document, and then it kind of has a couple sections. The first section is about eat the right amount for you. And then after that, they talk about protein. They say like focus on protein. And then the next section is dairy. And then the next section is fruits and vegetables. And then they say eat a lot of fat, basically like add healthy fats to all your meal. And then at the end, it says whole grains. They always mention full fat dairy. There's no mention of low fat or fat-free dairy. And they even discourage, like not directly, but if you read the language around the section on vegan and vegetarian diets, it's not like, it's not with like, oh, these dietary patterns can be massively helpful for your health, which is definitely what the most recent literature suggests, especially, in light of what I just mentioned about that scientific report really showing the benefits of plant-based proteins. But they sort of discourage them, and they kind of say like, yeah, they can be fine, but they call out all sorts of reasons why this really, we need to be careful and why they may not be the best. They specifically call out like eating a variety of plant proteins, which I'm all about. Of course, variety is great, but they say that the reason you need to do that is to make sure you get the right amino acid balance, whatever that means. I'm assuming that is a nod to making sure that you get all the essential amino acids, but that has been well shown that vegans even have no issues getting all of the different essential amino acids that they need. So it just like it doesn't really make sense. And so the overall, there is very clearly this recommendation for eating more animal products, which is not great and just not consistent with the most recent data, right? We know that eating a more plant-forward diet, I'm not saying that we necessarily need to eat vegetarian or vegan, although if you want to, I think that's great, but the data is very clear that eating more plant foods, plant proteins, and fruits and vegetables and whole grains, these foods can reduce the risk of disease and make you healthy and promote a healthy body weight and all of the things that these guidelines say that they're going to do, yet they're downplaying some of the most nutritious foods other than vegetables, right? Fruits and vegetables are there. I will give them that. But specifically whole grains and plant proteins being demoted over animal proteins is egregious and is just not consistent with the literature. And we know that more plant-forward diets are undeniably the best option for people wanting to prevent or treat, say, cardiovascular disease or heart disease or CKD, kidney disease, or kidney stones, right? Or cancer, or even GI concerns, right? We know that even diabetes, right? There's benefits of all of these conditions for eating a more plant-forward diet. Again, I use plant-based and plant-forward. Again, not to say we need to be eating totally vegetarian or vegan, but definitely eating more plant foods, which include, of course, plant proteins and whole grains and not a ton of meat. Which is what the guidelines very clearly portray. And I know that there's going to be haters, in the comments of this podcast saying, but it says in the text, it says to eat, things like beans and stuff. And yes, that's fine. The guidelines do, it does mention those things. However, as I said before, most people are not going to read even that 10-page document. They're only going to be looking at that food guide pyramid. And that food guide pyramid very clearly says that we should be eating steak and whole chicken and butter and whole milk. Yes, fruits and vegetables, but we shouldn't be eating a ton of whole grains, and we also shouldn't be prioritizing those plant proteins. They're fine sometimes, but steak very clearly should be our first source of protein, and it just doesn't make any sense. So that's my next thing that I don't love about him. I also don't love that there's not an official limit on alcohol. And famously, there's a clip from Dr. Oz on the news last week talking about how alcohol is a social lubricant. And so that's why they sort of lessened the language around alcohol, which I think is very funny because although we know that alcohol, there's likely no safe level, right? Like any amount of alcohol that you consume, there is a risk of a variety of things, right? And that is why previously the CDC as well as the Dietary Guidelines have this official recommendation of no more than 1 drink per day for women and no more than 2 drinks per day for men. So they got rid of that specific amount and they just said yeah, we should limit alcohol, but they definitely softened the language around it. And so I just have a hard time getting behind that. My next criticism of the new guidelines is that they really are just not representative of how people actually eat. There's really no gray area. It's kind of like eat real food, period, right? Like eat all this protein, eat vegetables, right? Like don't eat any salt, don't add any salt. And it's just, there's not a lot of room for gray area and flexibility to reflect the reality of eating healthy, right? Sure, if everyone had all the time in the world and we didn't live in a society where many people have to work 2-3 jobs just to make ends meet and they're working long hours and people had time to stand over in the kitchen and chop food all the time from totally unprocessed foods. And if people had time to do that every single day of their life, then fine, I'd be all about that. But the reality is that is not the reality, right? That's not the world that most people in the United States are living in. Also, even if it was to not leave any room for cake for your birthday or going out to pizza with your kids, right? That just doesn't make any sense. And I would argue holding people to those such high standards without any wiggle room is potentially impactful on their mental health. And the way that these guidelines are worded it leaves very, very little room for those sort of considerations, right? There really is not that gray area. I also, sort of along these same lines, don't love that there's no clear definition of processed food. They use the word processed food again and again and again and again. And certainly they do. In the food guide pyramid, there is a little picture of a canned vegetable and some frozen vegetables, I believe. But there's really not so I'm saying that because I'm happy that they at least acknowledge that those are processed foods, but they are healthful options because they are. But there's really no definition of a processed food. So things like, tofu is a processed food, but is quite healthful, right? Things like whole grain bread or crackers, rice that has already been pre-rinsed, an unsweetened flavored sparkling water, even sliced cheese is processed. And I know that this is cutting hairs, but there is so much focus on eating minimally processed foods, no processed foods. These foods are so bad for us. I have gotten a question from a student in Kidney Stone Nutrition School, like, is sliced cheese less good than block cheese because it's more processed? Like, it is leading people to ask these questions that really have no bearing. It's making healthy eating unnecessarily complicated. And although obviously I am all about eating more fresh, minimally processed foods, this sort of hyper focus on processing of foods, when not all processing is necessarily bad, and there are many healthful, nutritious foods, yogurt being another really great example, like, it just kind of, it's making people a little bit we're losing sight of the big picture here. So I fear that. And especially since they throw around this word processed and ultra processed food a ton without very clearly defining it, I think that is problematic. Also, I am a registered dietitian, and I have spent most of my career actually working in hospitals. And I just have to make this point because I think this is a very real reality for a lot of people. There are people out there who rely on, say, tube feeds for their nutrition, right? There are many people out there who rely on nutrition supplements for additional nutrition who are not able to get enough calories through, quote, normal food. And those are obviously processed foods. And so because we've done so much work demonizing processed foods, it's not only I fear, I know that there is then fear over these people who are super sick, who need this nutrition from tube feeding formula to live. I have had many of my dietitian friends and myself, I've had either patients or patients' family members be incredibly upset that their loved one is getting nutrition through a tube when it's this processed food, when like they are needing that to live, right? Like, I just feel like there's so much nuance, and whenever you start demonizing any food, right, or any whole group of foods, like you get into these gray areas, and it causes actual harm when there's such strong language around it. Again, I'm sure there's going to be people in the comments to this podcast saying like, oh, like, you're sponsored by Big Seed Oil and you're sponsored by Frito-Lay. I will tell you, I've not received a single cent from either of those companies, right? From any, quote, seed oil company. Like, this is just the reality of living, and also some of the benefits of processing foods, right? It's not all bad. It's not that black and white. The last thing I need to mention is that there is no mention of physical activity in the nutrition guidelines. Previously, there was a whole section on physical activity, and despite the fact that we are talking a ton about how, people in America are, such a large percent of us are overweight and obese, there's no mention of physical activity, which obviously has benefits for the promotion of a healthy weight, as well as beyond weight, even more importantly, has huge benefits on health, right? Regardless of weight. Moving your body is going to help reduce the risk of hypertension or high blood pressure, stroke, heart disease, cancer, like constipation, even like health, the mental health benefits, right? So many things. And the fact that there's no mention of physical activity at all is a little concerning to me. All right, and that's the end. That's the end of my general critiques of the dietary guidelines. I also wanted to do a quick comment. I'll try to make it quick. I know this podcast is getting rather lengthy, but a quick comment on sort of my kidney focus review of the dietary guidelines, because the dietary guidelines are not meant to be disease specific. Like, that is not why they are there. So, right, they're not meant to be recommendations for someone who has hypertension or recommendations for someone who has chronic kidney disease. However, I am a kidney dietitian, and I have dedicated my career to helping improve the health of the kidney community. And so I definitely want to comment on my thoughts around sort of interpreting these guidelines with my sort of kidney lens, right? Because I do think it's worth having this discussion, because yes, the guidelines are not meant to be disease specific. However, they are meant to help the population prevent disease. And kidneys are rather important. I feel like they don't get the love that they deserve. Again, this is a very biased opinion, but kidney disease is really, really common, right? We know that 1 in 7 US adults, which is about 35.5 million people, have chronic kidney disease. And most notably, up to 90% of people with early stage chronic kidney disease don't even know they have kidney disease, right? And a third of those people that have advanced kidney disease don't know that they have it, right? Like, that I could do probably 75 podcasts about why that is, but that's a whole nother topic. But the fact remains that 1 in 7 adults has chronic kidney disease, and an astonishing large percentage of those people who have CKD don't know that they have it. Plus, 1 in 3 adults is at risk of chronic kidney disease. Also of note, only about 10 to 20-ish, depending on estimations, of people with chronic kidney disease will ever meet with a dietitian prior to starting dialysis. Once you're on dialysis, it's a requirement to see a dietitian. But prior to that, very few patients ever actually meet with a dietitian. And I'm putting all of these stats out there because, yes, the guidelines are not meant to be disease specific. However, given the prevalence of chronic kidney disease and the fact that patients don't even know they have that, and certainly even if they do know, are not meeting with a dietitian, I think that there is a huge concern for harm to the chronic kidney disease population because of these guidelines, right? You don't know you have chronic kidney disease. You think, oh, cool, like I'm going to eat what this food guide pyramid says, which is telling you to eat a ton of protein from meat. Like, there is true harm, because we do know that although there's not data to show that eating a high protein diet or eating a lot of meat can cause kidney damage, there is definitely a lot of data to show that once you have chronic kidney disease, eating a very high protein diet, especially when that protein is coming from animal sources, can definitely cause complications. It can cause kidney disease to progress faster, literally causing you to need a kidney transplant or dialysis sooner, right? It can cause acidosis. It can make proteinuria worse. And at the end of the day, we know that people who consume more meat and who consume higher protein diets, but definitely the meat portion of that statement, tend to have a faster progression of chronic kidney disease. And so, yes, I know the guidelines aren't supposed to be disease specific, but given the fact that so many people have chronic kidney disease and they don't even know that they have it, and even if they do, they're probably not getting really good quality nutrition advice for what they can do to prevent it, so may not even know that protein plays a role in chronic kidney disease because they're not seeing dietitians. I think there is true concern that these guidelines could hurt the kidney community. That was just chronic kidney disease, right? And then moving into a kidney stone perspective, of course we know, if you've been around me for a long time, you know that eating a lot of meat isn't great for kidney stones, right? We know that when you eat a lot of meat or non-dairy animal protein is what the guidelines specifically call out, it increases your risk of stones, largely probably because it's going to reduce levels of urine citrate, it's going to reduce your urine pH, it could potentially increase urine calcium, and ironically could increase urine oxalate levels because all of that amino acid can basically upregulate your liver to make more oxalate, right? We know very clearly that people who eat more meat have more stones. And kidney stones are also not the most uncommon thing in the world, right? We know that kidney stones impact up to 12% of the population. Fun fact, that is more people than who have diabetes, which I always like to throw out because, again, kidneys do not get the love they deserve. But kidney stones are a very, very common ailment that impact a huge percentage of the population. And it's really hard to know who is at risk, right? Like, you don't know that you're at risk. Many people don't know that they're at risk for stones until they have a kidney stone, right? And also, I think it's fascinating to think that we throw out this percentage of, say, 10 to 12% of the population having stones. That's only known stones, right? Like, if we went around and scanned everyone's kidneys in the United States, I am sure it would be a lot more, because a lot of times people can have stones for decades just hanging out in their kidneys, and you would literally never know, right? Unless you're getting your kidneys scanned with a ultrasound or CT scan or something like regularly, which most people aren't unless they have a known history of stones. Like you don't know that you have kidney stones. And so it's really hard to know who is going to form a stone because of eating more meat and who's not. Obviously not everyone's going to, but definitely there is a not small percentage of people who are putting themselves at much higher risk of forming kidney stones by eating all of this meat and eating this much higher protein diet, but most notably definitely eating that meat. So the good things that I like in the new dietary guidelines from a kidney-specific focus are very similar to what I liked about the guidelines from a general health focus. I love that we continue to limit sodium and added sugar. I love that we promote fruits and vegetables, of course. And I do like that sort of discussion around limiting processed foods, because I think that it will likely result in the reduced intake of potassium and phosphorus additives, which isn't great for people with chronic kidney disease. Although I do wish that we defined that ultra processed food a little bit more clearly, and also again sort of at least gave nod to that nuance around some processed foods being very health promoting foods, right? But the things that I don't love, again, as I've sort of already talked about, is that very clear promotion of animal protein, that giant steak on the top left of the corner. I just can't get over it. Like we right? We read left to right. And the first thing that you're going to see when you are scanning that pyramid is that giant steak and diminishing those plant proteins, right? Which we know, again, are also beneficial for things like cancer, cardiovascular disease, and even diabetes. I also wanted to comment on the total amount of protein that the new guidelines are recommending, specifically with a kidney lens. So, I've done a lot of talking in this podcast so far about the meat, which of course where we get most of our protein, but the guidelines also essentially doubled the amount of protein that they're recommending. So previously, the dietary guidelines recommended 0.8 grams of protein per kilogram body weight, and the new guidelines recommend 1.2 to 1.6. So like I said, essentially doubling if you went on the high end of that range. Now, I think for the general population, I do think that probably that 0.8 grams per kilogram body weight is a little bit low. And I think that the data definitely does show that eating a little bit more protein than that could be beneficial for most people to help maintain or build muscle. However, I think going up to that 1.6 grams per kilogram is a little bit nutty, especially when you consider that most people in the United States are not moving around much, right? Like, we're not a very active population. And you also didn't recommend that people be active in the guidelines. And so, I think that we're not bodybuilders, right? Like, unless you are working out a ton, we don't need like a ton, like Olympic level, a collegiate athlete type level, which again, most of us are not doing, right? We really don't need to be going up on those way higher ranges. And obviously, even some of them probably don't need to do that either. So I think that for the general population lens, I think that maybe increasing it to 1.2 grams per kilogram would make sense. But I have a hard time with the increase all the way up to that 1.6 grams per kilogram, even in that range. And then if I put on my kidney hat, I have a huge problem with it because I think that those high protein diets, again, are not going to cause kidney disease. But I think for the very large percentage of the population who already has chronic kidney disease, especially when you consider that many of them aren't even aware that they have it, recommending that high of a protein intake could and will do damage to the kidney community, and certainly could increase kidney stones as well, especially since we're considering that we're recommending that a lot of that protein come from meat. The last thing that really bothers me, and I already talked about this when I was in the general health section of this podcast, but I wanted to come back to it again. The kidney side is very little acknowledgement of sort of socioeconomic factors that influence health and what you might eat. Again, sort of taking these very hard cut lines like you have to eat minimally processed, all these fruits, vegetables, fresh proteins, blah, 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 right? But very little acknowledgement of the fact that that might be virtually impossible for a very large percentage of the population. And I think that point is especially relevant to the chronic kidney disease community because we know that kidney disease disproportionately impacts communities, disadvantaged communities, right? Communities that are poor, communities of color. Chronic kidney disease, unfortunately, impacts these groups of people at much, much, much higher rates and much more viciously. We know that chronic kidney disease progresses much, much, much faster in Black communities versus white communities. And so all of that to be said, the bottom line, honestly, like if you're putting this all together, like what do we do from here? I've spent many, many minutes now digging into these guidelines and saying what I don't love about them. But at the end of the day, people in the United States are not unhealthy because of the dietary guidelines, right? Like, does this really matter? I guess is what I'm trying to say. And we're not healthy because of the dietary guidelines, right? It's no secret that Americans are not the healthiest group of people, right? Like that is not a secret, and we are all on the same page in wanting to improve that. But unfortunately, it's not because of the dietary guidelines. Only 10% of people follow them anyway, right? So to say that these new guidelines are going to suddenly magically make America healthy again is honestly laughable. And I do think that there is some harm that these guidelines could do, despite the fact that very few people are following them anyway, right? The many food service institutions are required, that especially institutions that receive federal funds, are required to follow the dietary guidelines to get those funds, right? Most notably school meals. So it'll be really interesting to see how school meals are changed as a result of this, because they legally, as long as they provide some of that free or reduced lunch meals, right, to students, which many schools do, of course, they have to follow the dietary guidelines. And so it'll be interesting to see what happens there and potential harm that's going on there. Any like Head Start programs, potentially different colleges or universities, correctional facilities, WIC, many food pantries or food banks, right? All of these, there's so many of these programs rely on the dietary guidelines as their basis for the food that they serve or the nutrition education that they provide people. So I do think that there is some harm that could be done as a result of these guidelines. Going into these avenues. And plus, the percentage of people that follow them, right, that 10% or so that follow the guidelines is quite low. However, I think that eating healthy is important to a lot of people. And so even though only 10% of people have been able to successfully implement the dietary guidelines, that doesn't mean that there's a very large percentage of people who are trying to implement the dietary guidelines, right? So that could be a very large percentage of people that are taking this to heart and they're eating way more whole milk and steak. And I think that there is definitely potential harm that could be done there. And again, kind of going back to why is America as a country not healthy? And it is not because of the dietary guidelines, right? Really, the things that are really going to move the needle and the things that we really should be talking about if we actually want to make America healthy are things like access to healthy food. At the end of the day, we all know that eating fruits and vegetables and eating, whole grain rice and like these things, we know that these things are good for us, but people don't have access to affordable healthy foods, right? We don't have access to good quality nutrition education. People don't have access to quality, affordable health care. All of those things are really why people aren't eating healthy foods, right? Like I know a lot of this podcast, I'm splitting hairs. I'm really going into the weeds here. But at the end of the day, people don't have access to these foods anyway. So it doesn't matter what we're trying to tell them to eat or recommend that they eat. They don't have access to these things, right? Those are the things that we need to be working on if we actually want to improve the health of Americans. Also, we need to address things like systemic racism in so many different institutions, neighborhood safety and walkability. If you don't feel like you can safely go out of your house and take a walk after dinner, it's going to be a whole lot harder for you to get healthy compared to someone who lives in a lovely neighborhood where it's perfectly safe to walk around at all hours of the day, right? Also looking at things like education and healthcare literacy. Can you go to the doctor and understand what they're saying, right? Even if you have the doctor who is most the most patient and takes the most time with you, but if you don't understand how to read a label on your prescription bottle, it's going to be real hard for you to take that prescription and actually improve your health, right? It's going to be really hard for you to figure out how to get to your appointment and like all these things, right? Like I could talk for hours about how that would impact the health. But at the end of the day, of course, educating people and helping to improve healthcare literacy is going to improve the health of Americans. Addressing things like economic stability. If you don't know where your next meal is coming from, you are living paycheck to paycheck. You don't know where you're going to live. Obviously, it is going to be really hard for you to focus on eating broccoli every day, right? Like you have bigger fish to fry. You have other things that are on your plate. Thinking about things like generational wealth, neighborhood engagement, right? All of these things go into the health of Americans. Nutrition is obviously part of it, but telling people what to eat is very different than them having access to those foods. And also, nutrition is only a small part of health at the end of the day. I have spent most of my career working with people on the west and south sides of Chicago, and I can tell you firsthand how these things play out, right? I have never met such a motivated group of motivated population than the patients that I worked with when I worked on the south and west sides of Chicago. But the unfortunate circumstance of where they live and their life just made it very difficult for us to implement any changes that are going to meaningfully impact their health. And honestly, we talk endlessly about how, America is so unhealthy and we have all these super high rates of heart disease and cancer, blah, 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 right? All this stuff. But when you sort of stratify people, the health of people with money is really good, especially white people with money. It's really good on average, right? The life expectancy can differ up to 20 years. Here in Chicago alone, in the wealthy white neighborhoods, people are living literally 15 to 20 years longer than the poor black neighborhoods, neighborhoods, right? Or the poor Hispanic neighborhoods. And so when you look at health and public health from that lens, like it's pretty clear that it isn't just the food environment. Not to say that we need to improve the food environment, and I'll talk about that next. Obviously, we need to do that. But when you consider the drastic healthcare disparities in just my city alone here in Chicago, but also across the country, it is very, very clear where we should be putting most of our efforts in to actually improve the health of Americans. And telling them to eat minimally processed foods has been going on for decades. This is not going to make a big difference in the health of America. Again, not to say that we shouldn't address the issues around the overwhelmingly easy access to those ultra-processed foods, if you will, as well as limited access to many healthful foods, if you will, right? Like certainly that is something that we need to address as a country, as a food supply. Like these are things that we need to do, and also work on reducing the cost of these healthy, nutritious foods, right? Certainly that is something that we need to address. But at the end of the day, you can have all the super cheap broccoli and apples and bananas and Brussels sprouts that you want in a grocery store. But if you put yourself in the shoes of someone who works 3 jobs, as a single mother who has to take the bus to work, to the grocery store, to daycare, to drop off her kids, who can barely pay rent, or someone else who might live alone, who can't physically get to the grocery store, and so asking them to go multiple times a week to maintain all this fresh produce in their fridge just simply is ridiculous. Like that's not going to work, right? Maybe this person also can't stand at the stove to cook or chop vegetables all day and is also living paycheck to paycheck. Like that is the reality for millions of Americans. And when you really take a second and put yourself in their shoes, it becomes very clear why people with privilege live so much longer and have much lower rates of chronic disease compared to those disadvantaged populations. And so I would argue that any conversation around the health of America, or any country for that matter, has to include these topics. And those are my thoughts on the new Dietary Guidelines for Americans. I hope that this was a helpful episode. I know it was a long one, but this is a big change in the world of nutrition, and I definitely felt that it deserved an entire episode. So hopefully you enjoyed it. As always, if you have questions that you would like me to tackle on the Eat Away Kidney Stones podcast, I'd love to hear from you. If you just head to kidneystonespodcast.com, you can record your question for a chance to get answered on the podcast by me. So yes, I hope you have a wonderful day. Happy Wednesday, and I'll see you next week on the Eat Away Kidney Stones podcast. Thank you for listening to today's episode. For more help with kidney stones, check out my website, www.thekidneydietitian.org. For more personalized help from me, check out my online course, Kidney Stone Nutrition School. VIP enrollment includes help directly from me. I can't wait to see you there and help you prevent kidney stones. Have a great day.